I just wanted to ask you, with all these new clusters, is a second wave inevitable in France?
In France? Well, no, it's not inevitable. And I'm not sure whether right now what we're discussing is truly a second wave or whether it's a moving wave, because what you can see is that the regions in France that seem to be affected, or where there is some beginning, are the regions mostly that were not affected at the beginning, in March and April. So New Aquitaine, Nouvelle Aquitaine, for example, that you discussed in your introduction. So the second wave is not inevitable. It is expected. It is highly probable, I would think, because of the virus and the way that it's being transmitted and the population movements. But the whole point is to make it as low and as possible so that the public health systems are not overrun. And that's true both in the US and in France and anywhere else. It's a matter of the timing, and that's the famous flatten the curve that we've been discussing.
Let's just talk about the US for a second, where there has been a lot of division on whether or not the country ever left its first wave.
Whether the country
has ever left its first wave, because there are some that say that the US or the surges we're seeing in the US right now in cases are representative of a second wave. And then there are medical experts that say, actually, the US never left its first wave. It's still on its first wave.
I tend to subscribe to that point of view, because you can see that the first wave, where New York, for example, at the beginning in March, was the epicenter of really COVID-19 in the US. And New York is actually one of the places right now that are doing really well, relatively. It's been really, it's one of the lowest point of view. While the other places that were relatively spared, including California and also a number of states in the South, are actually seeing that wave. So it's about the same situation in my mind as in France, where you have kind of a moving first wave, if we want to call it that way, that's actually going on with different states affected, and also a little bit of a different population. The age group affected both in France and in the US is actually different and seems to be a little bit younger.
And now, just very briefly, in your opinion, which countries are heading in the right direction when it comes to their coronavirus measures?
In the wrong direction.
In the right direction.
In the right direction. So, I mean, the countries that are, some countries we know have done pretty well. So, for example, Iceland has done really well. They've managed to, quote unquote, eradicate, if there is such a thing, COVID for at least 2 months, where they had 0 cases. And now, when they started slowly to reopen the country, they have a little bit of cases coming in, but they're testing everybody who's actually coming in. They have an aggressive program of testing. If you agree to, when you're at the airport, you either are tested or you agree to go to quarantine for 14 days. So another country is New Zealand that has actually been very successful. And there have been some countries in Asia that have actually been successful too. So there are a number of approaches, and we kind of know what works. We know that masks work. We know that. We know that aggressive testing works. And quarantine also works, but that's not the preferred way, because there is it's at the minimum inconvenient, and it has consequences also, of course, for the economy. So we know what works, because the virus, as had been said before, does not circulate by itself. It's people who actually carry the virus. So we know that those measures actually work. That, for example, wearing masks actually work. There's a difference in public health often about knowing what works and actually having it implemented. It's the same all the time. We know that seatbelts work, for example, in preventing death. Yeah.
Precisely. Maurice Devarieux, thank you very much for your time. We're going to have to leave it there, but thank you very much for your analysis.